myself. My name is Istifa Ajwa binti Jahiddin, metric number 055438 from Bachelor of Medical Imaging with Honours Year 2. The procedure that I choose is horizontal beam lateral cervical.
The patient will come on a stretcher trolley and wear a cervical collar to reduce the movement of the neck. Thus, before we doing the procedure, we should not under X-ray form about the radio opaque that may appear on the radiograph because of the cervical collar to prevent misinterpreted it as a foreign body. For this procedure, we need to bring the patient with the trolley adjacent and near to the vertical bucky. So for this situation, we assume the patient has been adjacent and near to the vertical bucky. We assume this is the side rest of the trolley. The cassette that we will use for this procedure is 24 x 30 cm and use grit. Put the sponge behind the cassette, which is in between the side rest and the cassette, and then we need to sellotape the cassette to stabilize it and to make sure it is parallel to the region of interest. But before placing the IR, we need to make sure that the center of the imaging receptor are parallel to the center of the cervical, which is at the C4. After we have made sure the center of the cassette are parallel to the center of cervical, bring the beam near to the patient and measure the SID is 150 cm. Collimate the beam to make sure the external auditory meatus until the C7 is included. And make sure don't forget to include the anatomical marker.
The final patient and part positioning will be like this figure, where we will do a direct shoot with the CR are perpendicular to the level of C4 and directed to the midpoint of IR.
This procedure will usually done on a trauma patient because of their condition. They usually will wear a cervical collar to reduce movement of the cervical spine. Do not attempt to move the patient for positioning without approval and instruction from doctor or any other physician to prevent any unwanted incident to happen on the patient. Thus, this is the reason why we should position the X-ray tube and the cassette rather than position the patient. The most challenging in taking X-ray of trauma patient is that we cannot move the patient into the desired position. However, we still have to try to obtain a high quality of diagnostic image on the first attempt. Why I choose the procedure? I choose the procedure because it is suitable to rule out fracture, subluxations or dislocation that occur at the cervical area, which is from the C1 to C7 as well as the C7 and T1 junction, so that further medical attention can be taken towards the polytrauma patient. Secondly, this procedure also useful in identifying ligament injuries because it usually presents as a malalignment of the cervical vertebra on lateral view. Thirdly, in this procedure, we tend to position the X-ray tube and the cassette rather than position the patient. This is because to reduce the exacerbating of the patient's condition. Lastly, the reason I choose this procedure because it will enable an accurate positioning with minimal patient movement, because in this procedure, the patient on the trolley will be placed adjacent and near to the vertical bucky. Here, it shows a normal radiograph of lateral cervical, where the cervical spine vertebral bodies have normal height and alignment. There is also no foreign bodies as seen, and also show clear demonstration of soft tissue margin and bony margin, and trabecular marking of cervical vertebra. No pathology visible in this radiograph. This is the abnormal radiograph of lateral cervical, where you can see there is a burst fracture occur at the C5 vertebral body with fragment traveling both anteriorly and posteriorly. There is also a fracture occur at the peduncles of C6. And that's all from me. Thank you.